Albany, Gov. Andrew Cuomo late Wednesday night vetoed a measure to keep the Western New York Children's Psychiatric Center operating in West Seneca instead of moving its patients to Buffalo. Cuomo did not explain his veto, which is required. Nor did Cuomo's office respond this morning when asked for his veto message. The veto occurred after his mental health commissioner, Drive. Ann Sullivan, visited the Buffalo News editorial board Wednesday morning and laid out the Cuomo administration's case for moving the West Seneca facility. Sullivan, head of the Office of Mental Health, said the move would allow the state to save millions of dollars and redirect that money toward other local services geared toward treating children in their own communities rather than a hospital setting. I think this is an opportunity, really, to use precious dollars to build up community-based services while still providing needed inpatient services in a really therapeutic, good environment for our kids, she said in a meeting with the Buffalo News editorial board. As a good faith gesture, the state has already begun providing $1.7 million worth of those services, such as its mobile integration team in which clinical experts visit families and children in schools and homes in several counties, Sullivan said. Closing the West Seneca campus would allow the state to expand that investment to $3.2 million, she said. Legislation sponsored by Sen. Patrick M. Gallivan, R. Elma, and Assemblyman Michael Kearns, D. Buffalo, would have prevented the state from moving ahead with the plan. It was passed unanimously in June in both houses of the state legislature. Bill to keep Children's Psychiatric Center in West Seneca is delivered to Governor Gallivan. Kearns and other opponents of the plan have called it a bad idea to house children in the same mental health facility as adults. Kearns questioned Sullivan's claims about cost savings and said after talking to mental health professionals during hearings he's convinced the West Seneca facility should remain open. We don't even know for sure what those cost savings are, he said. We've never gotten any factual numbers saying there would be savings. We have not seen that. Assemblyman Kearns held a press conference outside the Buffalo Psychiatric Center to protest the move of children to the facility. Matt Greta / Buffalo News. The two legislators collected more than 16,000 signatures from residents in support of keeping the center in West Seneca. The petitions were delivered to the governor's office with the bill. The bill landed on Cuomo's desk on November 22 and he had faced a deadline of Monday, December 4, to sign or veto it. Gallivan expressed his sentiment in a tweet about the veto. Legislation that would have required the Western New York Children's Psychiatric Center, WNYCPC, to be maintained as a separate and distinct entity, was vetoed by the governor just before midnight. Disappointed at Save WNYCPC at Mickey_Kearns West New York Nicenate. Senator Gallivan, at Senator Gallivan, November 30, 2017. The chances of a veto override by the state legislature on such a local matter is seen as virtually nil. For years, state officials have discussed the possibility of closing the West Seneca facility for children, which is located on East and West Road.